So recently, my restless leg syndrome patients who are on buprenorphine have been asking me a lot about the FDA's communication about dental problems from the medication that was back in 2022. So, just how serious are the dental risks of buprenorphine and what should be done about them? I'm Dr. Andy Burkowski of ReLACS Health. Now, buprenorphine is an excellent and unique opioid medication, most commonly used for the treatment of opioid use disorder and also chronic pain. But it's growing in popularity for use in restless leg syndrome, where opioids are considered now a second line treatment for moderate to severe restless leg syndrome. The advantage of buprenorphine over other opioids is that it typically does not cause respiratory depression, which is a slowing of breathing, pretty much the cause of death with opioid poisonings, as are occurring commonly in the US right now. So it takes away one of the biggest risks of opioids as a treatment. And it also has other beneficial effects, including less likely to be abused because it doesn't really get people high or cause what we call euphoria. So in 2022, the FDA released a communication saying that we should be aware of different types of dental problems with the covering of the teeth, the enamel, the pulp, and increased risk of cavities, infections, or tooth loss. So what is the evidence for how serious these side effects are with buprenorphine? Well, a 2022 study in the Journal of American Medical Association in December by Etmanan and others from Canada and the University of Michigan Dental School looked at this database of reports of pharmacy-related side effects and conditions. And they looked from 2006 to 2022, and it was patients with opioid use disorder. So 21,000 patients in this database were started on buprenorphine-naloxone. And they compared it to patients in the same time frame that were started on naltrexone that was taken by mouth, which is an opioid blocker, and buprenorphine that goes through the skin, or transdermal buprenorphine. And they found that compared to those other two groups, the buprenorphine that dissolved under the tongue was 1.4 times more likely than the transdermal buprenorphine to cause dental problems, and 1.7 times more likely to cause dental problems than the naltrexone. So this seems like quite an increase. So there is something there. But overall, among all patients, the risk of a dental problem while on this medication was about 2% per year. And in these other two groups, it was 1% per year. So the absolute risk difference was about 1%. So you have to balance that there are potential side effects of these medications and look at the overall rate and factor that in with your decision making. So when the FDA released this communication, really what should be done? So from what I've looked into, it's not clearly known what is in the buprenorphine that dissolves in the mouth, but they do think it might be due to increased levels of acidity and maybe dryness, and that can lead to different types of bacteria that may lead to tooth decay. So one of the things that would be recommended is after this film or tablet dissolves in the mouth after about 5 to 10 minutes is to really rinse out the mouth well with water, and not to actually brush your teeth within 1 hour of taking the film or tablet. And this is because the enamel or the coating of the teeth may be more vulnerable to damage from the toothbrush when otherwise the toothbrush would not cause harm to it. But overall, brushing teeth at least twice per day, seeing the dentist very regularly, and also making the dentist very aware of these risks with buprenorphine are a good strategy for continuing to take buprenorphine while mitigating some of the increased risks to dental problems. Because this medication has so many advantages, including in restless leg syndrome with its safety, one must always weigh the risks and the benefits, the risks of things like dental problems with the benefits of buprenorphine as a whole, not just for people with restless leg syndrome, but people with opioid use disorder and other chronic pain conditions. So this should be discussed in the concern should be discussed with the prescribing clinician regarding risks and benefits of all treatments. As always, this video is for general information purposes only. It does not constitute the practice of medicine, and all medical decisions should be made under the guidance of a licensed medical professional. One of the keys to sleeping well is to relax.